Okay, so we're going to be doing the spinal anatomy first. So we're looking at anatomy as it relates to bony structures. We'll look at joints. We'll also look at, of course, the muscular anatomy of the spine as well as the lower extremities, so hip, knee, foot, and ankle. So in no particular order, other than the fact that I'm starting with the spine, I'm just going to look at this skeleton, which is right in front of us, and then we'll move it out of the way. So just to remind you that the cervical spine has a lordotic curve, which comes in like this. 7 cervical vertebrae, and we see the transition at T1 is the one, of course, with the ribs. Notice that the spinous processes and the thoracic vertebrae start to point downwards a little bit. That's, of course, to stay out of the way of this kyphotic curve. Lumbar curve back, or lordotic curve back in the lumbar spine, and then the sacrum, of course, 5 fused bones, cossack 3 to 5 bones. Just turning this around, we can take a look at the discs in the vertebral body. You see the discs are quite large in this area. The outer part of the disc is known as the annulus fibrosus. Inner part of the disc is the nucleus pulposus. Ribs, of course, come off of the thoracic spine, 12 thoracic vertebrae, and of course 12 ribs. Bottom 2 are free floating ribs. And then as we move up to the next 3, moving from bottom up, we notice that they come through a common cartilage, inserting finally into the bottom of the sternum. Then we have the other ribs, which are known as true ribs, coming in directly through costal cartilage into the sternum, manubrium, and xiphoid process. We'll just pull this aside now and continue looking into the spine. And we're going to look at a couple of classic vertebrae. This is the lumbar vertebrae again. We saw that in the spine. Large vertebral body. The spinal foramen is relatively large. When we compare that to the thoracic spine, you can see that the lumbar vertebrae is quite a bit wider. In fact, the spinal cord is an hourglass shape. We have superior articular facets and inferior articular facets. These are arthrodial or gliding joints. Spinous process, transverse process. Looking at the thoracic spine, again, a little bit more narrow spinal foramen, a little smaller body, but the really big difference here is that you start to see a very small little facets on the transverse process, as well as on the body. These little demi-facets are the attachments or articulations for the ribs which would come around. Looking at a typical cervical vertebrae, one of the things that jumps out is a bifid spinous process, or it's split. You once again see superior articular processes, inferior articular processes, and then this foramen on the transverse process, which is for the vertebral artery. Once again, you'll see a very wide spinal foramen, and this is for, again, the hourglass shape of the spinal cord itself, quite wide up into the cervical area. We'll put that down there. We'll continue looking at some of the bones as they relate to the skull and the spine. Looking here, of course, at some of the major bones of the skull. I'm just going to turn this upside down so we get a look, of course, at the foramen magnum. And some of the muscles we've been talking about relate to the TMJ. This is the sphenoid bone. We're looking at the wings of the sphenoid bone. These are the origins for the pterygoid muscles that we've talked about in terms of movements of the jaw, both side to side and protruding the jaw. If we turn over to the side, we see the zygomatic arch. We'll see the origin for masseter up here on the zygomatic arch. And then on the temporal fossa, we see the origin for temporalis. Both of those muscles will come down to insert into the mandible. Here down in the ramus of the mandible, we see the insertion for masseter. Up into the coracoid process, we see the insertion for temporalis. Both these muscles are very strong muscles involved in elevation of the mandible. Taking a look at a bit of the disc, in the disc we see the outer part is the annulus fibrosus, about 8 to 10 concentric layers, and then on the inside is the nucleus pulposus. Looking at this part of the disc, we see we see the lumbar and the sacral spine, the sacral plexus down here. We're looking at a disc herniation. Of course, we're looking at the discs here made of, these are amphiarthrodial joints, and again the annulus fibrosus on the outside. Put that back down, and we're now going to take a look at this model over here as it relates, first of all, just to the spine. Some of the key muscles that we can see on this model here are part of erector spinae. Just to remind you, it would have 3 layers. On the inside it would have spinalis longissimus, and then on the outside iliocostalis. Over here we're looking at quadratus lumborum. As we turn this around, we see iliacus, which we'll talk more about as a hip flexor, and then psoas attached up onto the lumbar vertebrae. Looking higher up in the up in the spine rather, we see scalenes, posterior, middle, and anterior scalenes with the brachial plexus coming between. And if we just lift up the mandible, we'll see in here the deep flexor of the cervical spine, the core muscle, which is known as longus coli, and this, of course, being the hyoid bone. We're just going to move this aside for a second. We'll come back to that when we look at the hip. Continuing on the journey, looking at the spinal muscles. On this model here, we'll look first of all at the trunk. We can see external obliques coming down in this fashion like this, and they are matching up with or dovetailing with serratus anterior. This is the second most superficial muscle of the four. The most superficial is rectus abdominis right in the front. If we turn around on this side, we'll see a deeper layer. We can see internal obliques. And if we were to remove this entire plate, really deep going horizontally would be transversus abdominis. I'm going to come back up to look higher up into the spine. We see sternocleidomastoid. On the side, we'll see scalenes. Sternocleidomastoid, because it runs on an angle, has an interesting action of side bending to the same side and rotating to the opposite. I'm going to turn around to take a look at the back. And on the back, we see up high, first of all, Splenius Capitis. Underneath it, Splenius Cervicus. Over here, we're looking at Erector Spinae. Up here, Erector Spinae just changes its names again to Splenius Capitis and Splenius Cervicus. We, of course, are looking at trapezius cutaway here. If we turn this model around, we'll take a look at one of the Tmj muscles. This muscle up here in the temporal fossa is temporalis. And if I turn around, we'll start to look at some of the facial muscles. This muscle here, which causes the eyebrows to come down and in, is known as corrugator. This muscle up top, which would raise the eyebrows, is occipital frontalis. Going around the eye is orbicularis oculi. Going around the mouth, orbicularis oris. Coming from the zygomatic process to the corner of the mouth is zygomaticus. Pulling the mouth back as to assist in smiling is risorius. And then this little muscle here, which is sometimes known as the doubting muscle, is mentalis. Over here we can see masseter, again, this powerful muscle which is involved in elevating of the jaw. We'll leave that model there. We'll come over to look at this half open torso. And on the open torso, we can see, for our purposes, again, focusing on the lower extremity of the spine, we can see iliacus, psoas, and then a nice look at the three layers of the abdominal muscles. Here's transversus abdominis, which would come all the way around, tying into the linea alba. Internal obliques, external obliques. So that's iliacus, psoas, transversus abdominis, internal obliques, and external obliques. Just going to move that to the side as we now take a look at some of the other muscles as they relate a little bit further down. We'll now move into the hip. Let's start taking a look at a model which shows us some of the soft tissue, ligaments of the hip. We're looking here at the labrum of the hip, which deepens the socket. Some of the bony processes to note here is the ischial tuberosity. This is the PIS. This is the sciatic notch. This is the iliac crest. Coming around to the front, ASIS, AIIS, greater trochanter, lesser trochanter. And of course, the head would articulate deep into that acetabulum. This is the obturator foramen, pubic crest, pubic symphysis, and this is the rami around the obturator foramen. We have a pubic rami and then we have an ischial rami. Moving into the muscles of the hip, take a look at this leg model. We have iliacus, gracilis, sartorius, and semitendinosus all come into the pes anserinus. Continuing with now adductors, adductor longus, adductor magnus here, here, and here. As mentioned, semitendinosus, semimembranosus, turning over to long head biceps femoris, short head underneath. Vastus lateralis, tensor fascia lata. Rectus femoris, underneath it, rectus or vastus intermedius. Vastus medialis. Gluteus medius. Coming around to the deep six, we can see 5 of them. Piriformis, superior gemellus, obturator internus, inferior gemellus, and quadratus femoris. Let's move down now into the area of the knee. First of all, we see gastrocnemius and soleus. If we were to take off gastrocnemius and soleus, you can see the layering effect, soleus being deep. Looking at the nerve coming down the back of the leg, we see the sciatic nerve here, splitting about halfway down the femur to the common fibular nerve, which would innervate the short head of biceps femoris, and then the tibial nerve coming down the back of the leg. The tibial nerve will innervate gastrocnemius and soleus and everything on the back of the leg. Let's look at the muscles on the back. Popliteus, tibialis posterior, flexor hallucis longus, and this muscle here is flexor digitorum longus. Notice that tibialis posterior, because it's so deep, pops out here again, and you see the tendon right there. Tibialis posterior, flexor digitorum longus, and flexor hallucis longus. On the bottom of the foot, on this model, we can see some of the layering. There are 4 layers of muscles. You get to see abductor hallucis, abductor digiti minimi, and flexor digitorum brevis. You also get to see the lumbricals in here. Moving over to the lateral surface of the lower leg, we'll see fibularis longus, fibularis brevis. These are innervated by the superficial branch of the common fibular nerve. Extensor digitorum longus, extensor hallucis going to the big toe, and tibialis anterior. Note that there are no muscles on the medial surface. It's just the tibia. We'll continue on with the foot. Moving into the layering of the foot, we have 3 muscles as mentioned in the first layer of the foot. This is abductor hallucis, flexor digitorum brevis, and abductor digiti minimi. Just flex back the plantar fascia. And if I pull back flexor digitorum brevis, we'll also see, I'm just going to remove abductor hallucis, and we'll see quadratus plantae and the lumbricals, as well as the medial and over here lateral plantar nerve coming from the tibial nerve. On the medial side, just again, we'll see this in the 3 positions: tibialis posterior, flexor digitorum longus, and then flexor hallucis longus right there with the tibial nerve. On the lateral surface, we'll see attached to it the superficial branch of the common fibular, innervating fibularis longus going under the foot and fibularis brevis to the 5th styloid process. On the front, attached to the 3 muscles, this is the deep branch of the common fibular nerve. Taking a look at some of the bones in the foot and ankle, we're of course looking at the tibia, the fibula, medial malleolus, lateral malleolus, talus calcaneus, navicular, cuboid, and then the cuneiforms, medial, intermediate, and lateral cuneiforms, metatarsals, phalanges. Moving and looking at the femur, main landmarks are of course the head, neck, greater trochanter, lesser trochanter, linea aspera down the back, which is made of the lines of gluteus maximus, or the gluteal line, and the pectineal line from pectineus coming together. Condyles of the femur. On the tibia, the main landmarks to see are the plateaus, Gerdy's tubercle, the insertion of pes anserinus, those 3 tendons, and of course the malleoli. Note on the fibula just the number of origins. In fact, that's really almost exclusively what the fibula is. The origins for a lot of muscles controlling actions of the foot and the ankle. On the small model, we can see a few muscles as well. Get a look at a little bit of external obliques as well as rectus abdominis. We can definitely see sartorius, rectus femoris, vastus medialis, vastus lateralis, tensor fascia lata, as well as we get to see the hamstrings, the long head of biceps femoris, short head poking out just a little bit, semitendinosus, semimembranosus, gastrocnemius soleus, fibularis longus, and then as far as getting down here, it starts to get a bit small, but we're getting extensor digitorum, extensor hallucis, and tibialis anterior. Let's take a look at the knee. And in the knee, we have the tendon for quadriceps, the patella. And then we have ligamentum patellae. If we reflect that aside, we'll see anterior cruciate ligament. Lateral meniscus, over here would be medial meniscus. This is medial collateral ligament. Turning around, we'll see posterior cruciate ligament. And again, good look at the meniscus here. Okay, I think that's good. I think we covered everything. I probably missed a few things, but as it happens.